Welcome to A Balanced Life on the Go. I'm Dr. Nicole Lindsay, your host on this podcast, along with Dr. Brian Jeanette. This is a podcast designed to help connect you to a more balanced life on the go. Each week, we will bring you simple, concise, and easy to implement ideas, tips, and strategies to help you connect to better nutrition, movement, and thinking so you can achieve balance in your busy life. Isn't this what life is all about? Trying to achieve balance so that we can be healthy, happy, and live to our fullest potential. We're glad you joined us. Let's get started. I am here with Dr. Kelly Van Wagenen, also known as Dr. V. She is a friendly and dedicated general dentist working at Zoe Dental here in Asheville, North Carolina. Dr. V and the other 3 dentists at Zoe Dental strive to provide excellent comprehensive care with the goal of changing people's perspective in dentistry. Dr. V attended dental school in Buffalo, New York, then went on to complete a 1-year advanced residency program through East Carolina University here in Sylva, North Carolina. She has always wanted to become a dentist. Having earned her undergraduate degree in respiratory care, she was excited to combine her 2 passions by treating sleep apnea with custom oral appliances. And we're going to be talking a little bit about that over this podcast. Dr. V pursued additional training to treat patients diagnosed with sleep apnea and is a diplomat of the American Board of Dental Sleep Medicine. Dr. V is originally from Connecticut. She fell in love with the western North Carolina mountains like the rest of us when visiting the area 7 years ago. She and her husband, Chris, have settled just outside of Asheville. They enjoy spending time outdoors, home projects, and cuddling with their fur family of dogs and cats. Thank you for being here. Welcome.
Thank you for having me. Looking forward to sharing our knowledge and really letting people know what they can do to take care of themselves, oral hygiene, and the rest of their body.
Yes, Dr. Kelly is a dentist here in Asheville. She practices at Zoe Dental, and she is originally from Buffalo, New York.
Connecticut originally.
Oh, Connecticut originally. She attended school in Buffalo, New York. Then she went on to complete a 1-year residency program through East Carolina University in Sylva, North Carolina. Mm-hmm. So that's what brought you to the wonderful mountains of North Carolina. Dr. Kelly earned an undergraduate degree in respiratory care, and she's excited to combine her 2 passions of treating sleep apnea with custom oral appliances. And we're going to talk about that along with TMJ, oral hygiene, many other things over the next few minutes on this podcast. So thank you for being here again. So first of all, I know that we've had this conversation about oral hygiene, spinal hygiene, the importance of maintenance, the importance of looking at the body as a whole.
Yes.
One of the things you said to me was, I loved when I came in as a patient, which just violated HIPAA there, you looked at the body as a whole, and I love that perspective because that's what we do in our office. Tell me more about that.
Yeah, so it's exactly what we do in our office, and from when I stepped in as a patient here, I really felt, at home, being treated like a person, and knowing we're all striving for the same thing with our health just being primary concern. With comprehensive care and the aspect of that, we know that there's certain aspects of oral health and spinal hygiene that can affect other areas of the body. So when you come in as a new patient to our office, we do a comprehensive exam where we do evaluate things like if there's TMJ symptoms, and we'll talk about that some more. If there's any evidence of inflammation in the oral cavity that can affect the rest of your body. Inflammation anywhere in the body can affect other areas, so we want to make sure that we can have the utmost health aspect for comprehensive care.
So you're not just treating the tooth that hurts or the gum problem.
Exactly.
You're looking at the whole picture.
Yes, absolutely.
So would you be considered a holistic dentist? Is that a term for?
I wouldn't say holistic dentist. We are a general dentist office, but we do recognize that patients will have their own preferences for how they treat themselves, and we give our recommendations, our findings, And we do want to have our approach be as conservative as possible so that we can treat the whole body in that aspect.
Do you give specific recommendations on, do you incorporate dietary recommendations and maybe sleep positions or other things that affect their lifestyle?
Absolutely. So when we look at what the best oral hygiene maintenance program is for a patient, we look at what factors could be affecting them individually. So things like hormones for patients that are pregnant or breastfeeding, we want to make sure that they're having the correct diet and hygiene to be able to take care of themselves. Patients who have cancer undergoing chemotherapy treatment, that could have different effects on the oral health, and so there's different ways to manage the system in that aspect.
I love that. I think it's so important, and that's why, this month we are really helping patients to focus on their oral hygiene, because it's that important. It means more than just your tooth is unhealthy,
yes.
Right? So if your gums, your teeth are not healthy, there may be a problem elsewhere in the body, and that's just the way it's presenting or reflected at that moment in time.
Yes. So
ultimately we can extract the tooth, we can, fill the cavity, but really what's going on systemically, what's happening in the body.
Mm-hmm. And not having dental treatment done where you have either an active infection in the oral cavity or generalized inflammation that's been chronic, that shows to have a effect on blood pressure, the heart. It can have increased risk of things like stroke. So when we have patients in part of our comprehensive evaluation and just routine care is to take their blood pressure, review their medications, their medical history, make sure that they're having a primary care physician that they're working with, so that we can really advise if there's something that's going on that we can see a sign of in the oral cavity that could be affecting other parts of the body, that we make sure that they're on the right track to get that resolved.
So would you say that your oral hygiene can be used as a tool to determine how healthy your body is?
I would say that absolutely. We can see signs of certain aspects that with diabetes, for example, if we see any increased inflammation within the oral cavity with bleeding gums, that may be a sign that the patient's not having their diabetes under control. So we'll certainly see that effect in the oral cavity.
So I'm always curious how people got where they are, why they chose the profession they're in. I get that question a lot. What made you, at least 3 times a day, I'll get that from patients, what made you want to become a dentist?
And I love this question because I feel like a dental dork when I talk about it, but I've always wanted to be a dentist. I loved teeth since I was younger. I have a younger brother who I pulled his baby teeth out when they were loose. And so I knew that I had that passion, and I was fortunate to have a wonderful dentist growing up who talked with me and had educated me properly and was always so warm and welcoming. So I knew that I wanted to really have that same concept, and so I found that working primarily with adults in our practice, that I really enjoy helping patients break through their fears, their anxiety. It's something that we know it's not your favorite place to be, but I love being able to break through that barrier with someone and really see someone come out on the other side and feel wonderful, and maybe even look forward to coming back to see us.
Yeah, we do have a lot in common, don't we?
Yes, exactly.
Yeah, that's one of the things that I love about chiropractic too. It's very similar. So many similarities between our professions and what we do. But the fears that patients have when they come in, most people have some sort of fear that it's going to hurt, and they don't like the cracking, the popping, and they're not looking forward to it. And that's one of my goals as well. I love being able to make them see that you're going to be okay. This is going to be a good process all the way through. You may actually enjoy this, and you'll look forward to coming back.
Absolutely.
So I totally get that. Let's see what's going on here. It's still going. Okay, so let's go into TMJ. Let's talk about what that is. And I know a lot of people suffer with this, and sometimes people call it that. They may not have it, and some people don't realize they have it, but they do have it. So what is TMJ?
Yep, so when we talk about TMJ, the definition of TMJ itself is the temporomandibular joint. So when we have issues of TMJ, we say it's a TMJ disorder, TMJD. And what the TMJ is where the joint is, where the lower jaw, so the mandible, meets the skull, so at the temporalis region. And that joint makes up several muscles that surround it. There's also ligament fibers that make up around that area. But what that joint does is it works so that we function as far as speaking, chewing, yawning. It's used, day in and day out, daytime, nighttime. So that joint can have issues with either within the joint itself or in the musculature around it. So that's one of the things that we do for our evaluation is determine if it's in a muscle that makes up around that joint or if it's within the joint itself.
There's also the disc that's within that space as well. And I've always, at least in our practice, we found that disc can actually become displaced or inflamed. That can be another part of the problem, or from injury if you've had some kind of trauma, or perhaps the muscles in the neck and shoulders, and then we're talking a reverse curve that can also tug and pull on that joint as well and displace that disc.
Yeah,
Have you
so
found that
a disc,
as well?
yeah, absolutely. A disc displacement is one of the most prevalent things that we see when there is a disorder within the joint. What that typically will happen is that the disc that will go over the portion of the mandible will be displaced anteriorly, so more forward, and then patients will have issues typically with being able to open properly. And a lot of the times we'll have a popping sound that's associated with that. When we do an evaluation, we don't necessarily consider sounds to be an issue per se unless there's pain or dysfunction associated with that. So when we see that disc is displaced, we want to either manage having side effects happen from that, or if we're able to get that disc back into position, that would be the ideal resolution there.
So that's the disc displaced. So there's several reasons, several causes to the TMJ,
Absolutely,
right?
yes.
So the disc being displaced is one. Did you say muscle imbalance?
Yes,
is
muscle
another?
imbalance. So that's a lot of what we'll treat in our office is having a muscle issue. And there's 4 primary muscles that will surround the joint. So, it's a small space, but it does have a lot of radiating factors to it. So if there's a muscle imbalance, we'll see pain maybe on one side and not the other. If there's an imbalance as far as how your bite comes together properly, that will throw off the muscles too, and we may have pain on both sides, one side, but that's where we start evaluating for treatment.
And so that muscle imbalance, if we can back that up a little bit, where do you find that comes from? Of course, I have my own ideas, but where does your mind go when a patient presents with a muscle imbalance?
Yep. So we'll see a lot of times will be from clenching or grinding is a big factor for that. Especially with stressors that can influence that. We've seen a big increase in that, through the pandemic, through things like life changes can really throw things off where patients won't even notice that they're clenching in their sleep because they've been so stressed out, they've been really working out those muscles. And then depending on how your joint functions, we may have one-sided muscle really being worked out more than the other side. And so that's when treatment comes in handy, where we're able to release the tension in those muscles, have less pull in the areas that have been having more pull, and let the disc joint relationship return back to normal and be free of pain.
Yes. Okay. Yes. So grinding, stress in the night, from a chiropractor's perspective too, an evaluation, we find that what can cause the imbalances as well, cervical curve, we should have a lordotic curve, a C-shaped curve in our spine, and cervical spine, and oftentimes we will develop a loss of that lordotic curve and even a reverse curve in some cases, whether it's genetic or an accident, if we've been in a whiplash injury even years ago that was not restored, not fixed. And then that can tend to cause the the cervical spine, the neck, the shoulder, and the jaw to tighten up on one side versus the other over time.
Yes.
So that's what we can see, and that oftentimes will resolve if the muscle imbalance is coming from that. You were asking, I'm interested in how you, as chiropractors, can treat TMJ. This is one of the ways that we find that connection is if their neck, shoulder, forward head posture, and then with devices, phones, computers, all of this, we're seeing more of this forward head posture now more than ever, which is also adding insult to jaw injury.
Yes, absolutely. And part of the comprehensive aspect of how you walked me through as a patient for myself was with my profession. We'll start to have changes in that curve that we want to avoid, and you've taught me ways to maintain that, and I think that patients will benefit greatly if we can make sure we get the correct diagnosis, know
Yes.
what muscles are affecting the problems that we're having, and make sure that we're treating things from that whole perspective.
Yes. So which muscles? You said 4. So masseter?
Yes.
Lateral pterygoid?
Lateral and medial pterygoids.
Okay,
Yep.
so 3, and what?
And then the temporalis.
Temporalis,
Yes.
okay.
So the temporalis is the one that really spans across the head. So we'll see things like headaches, migraines, eye pain, ear pain as well, with the ear canal being right next to where the joint is. That's something that I would typically refer to physical therapy or chiropractic care, so that we can assess to see if it's coming more from the skull base. From more of a dental standpoint, with the masseter, that straps right across and connects the lower jaw to essentially the skull as well, and that's where we'll see primarily enlargement, or the muscle will be overworked from clenching muscles. That's a big muscle of use for just every day, and so we want to be able to keep that muscle healthy so that we can still function.
And then is the pterygoid the one that affects opening and closing the mouth the most?
It does, and it does have to do with the translation aspect of it. So with the muscle, with the joint, it will have a hinge aspect where we start to open, and then the lower jaw will actually start to slide forward. And so that's where those pterygoids will also come into effect.
Okay.
Part of what we do for being able to release those muscles is be able to take off any pressure points from the back teeth touching each other, so that those muscles can relax, release themselves, and let that joint sit in its comfortable base position. So that's one aspect of our treatment with the pterygoid.
So going in the mouth and doing trigger point work or separating out, yes. And that is actually something that we do as well. So we'll assess that and we'll make space, if you will.
Yes.
You're kind of like sweeping that with your finger, and it's very painful for the patient, but it doesn't last long.
Right.
I've also trigger pointed the masseter on the outside, and I teach the patient how to do that if I find trigger points in there. So that's some of the things that we do.
Absolutely, and
well.
it's so effective because it really treats the primary cause, and that's a big aspect of it, is treating the primary cause and then being able to maintain so that we can prevent that from flaring up.
Absolutely, yes. TMJ is painful, and there's nothing worse. I've never had it, so I can't imagine this pain, but sitting in front of your favorite meal and not trying to figure out how you're going to chew the food because your mouth hurts so much. So that has to be horrible. So yes. So sleep apnea. Sleep apnea is another area that you specialize in.
Yes.
If I can use that word, right? I know some professions, it's funny, you have to be careful using that word, but you do. And you're one of the few dentists that actually do work with sleep apnea. So let's talk about that.
Yeah, absolutely. So I'm very passionate about being able to help patients that are diagnosed with sleep apnea or haven't been diagnosed with sleep apnea but are showing signs of it. Part of our comprehensive evaluation is an airway evaluation. So we assess to see if there's a lot of constriction in the back of your throat or an enlarged tongue, things that would possibly block your airway while you're breathing. And someone that's diagnosed with sleep apnea will have events during the night where their airway is either partially blocked off or completely blocked off, where they're not able to breathe in their sleep. And it, as a partner perspective, it can be very scary to see your partner not breathing in their sleep or gasping, waking up gasping. So the primary...
I don't know. It might come in handy. Kidding.
You get the pillow and... I do know just from personal, my husband does have sleep apnea, and so the first night where he was treated with it, and to be able to see him restfully sleeping was just such a relief.
Wow, that quickly.
And, yeah, absolutely. So there's several treatment options for sleep apnea. Where I come into perspective of that is where an oral appliance is indicated, and it's a great aspect for treatment where patients who cannot tolerate wearing a CPAP, who for either claustrophobia can be one issue with that, if they sleepwalk and then you're not able to take your CPAP machine when you're walking around during the night, or if they just cannot handle having that airflow coming. It's a great treatment, but if you're not going to wear the device, then it's not going to be doing its treatment. So an oral appliance, what it does is, the main goal is to bring your lower jaw forward so that we can bring the tongue and the tongue base that actually extends back further than what we see, bring that forward so we can keep that airway open. So one big part of my evaluation, if you're a candidate for an oral appliance, is to make sure that we have a healthy starting base, and that's including your oral cavity with teeth and gums, make sure that everything in there is healthy, but also making sure that your joint is healthy, because we don't want to put any stress on the joint if it's not going to be able to handle that. So that's a big aspect of where we start with. If I have a patient who may have a joint that is causing discomfort before we start treatment, that would be where referral to you would be a great thing to be able to get us to a better standpoint for that.
And you brought some appliances
with you. Yes.
So let's see what they look like. So this is something you would have to wear indefinitely?
So if a patient is able to make lifestyle changes, if that is an aspect of what's led them to sleep apnea, such as weight gain, that's a big component of it. If they're able to reach a healthy weight where they don't have sleep apnea with that, then we don't necessarily need to have any treatment for that anymore. If it's a hormonal influence, so as we age, and especially for women, there'll be a change in the elasticity of your tissue, and so that may be a reason where, yes, this would be something that you'll probably need to have the rest of your life. But most patients really find that their life is more worthwhile. It's meaningful because they wake up feeling rested.
For sure.
Know they were sleeping, breathing during the night. So this is an example of an oral appliance that we would have for sleep apnea. The two components of it fit together, and there's adjustments on either side of this so that we move that lower jaw forward. And one of the great things with having an appliance for treatment as well is we'll often see that there is clenching and grinding associated with that, especially if your body is naturally trying to open up your airway during the night. You may be thrusting your jaw forward during the night and having that grinding mechanism happening. So this is meant to help protect the teeth, but then also treat that sleep apnea.
Okay. And because you're pulling the bottom jaw forward now, we shouldn't worry about the TMJ.
Correct, yes. So we want to make sure that we're going to bring it back to a comfortable position. So we do this over time so that we're able to slowly let those muscles adjust over time. And then the very important thing for maintaining long term is in the morning we'll instruct patients on certain exercises to do. So that we make sure that the bite returns back to its normal position and let those muscles relax a little bit if they've been stretched. Sometimes there's some initial discomfort with it that is resolved within just a few nights wear.
Okay. How much time does it take typically to get from start to finish to get your ideal position?
So every patient will be different with that. Typically we'll see really over 6 weeks of time to be able to get to our ideal position. After that 6 weeks, I typically will recommend giving until about the 3-month mark, just to allow the tissue to all adapt to these new changes, and then follow up to evaluate for treatment as far as making sure that it is effective from a sleep study perspective, and referring back to the pulmonologist for that.
Okay. So does, if a patient wanted to come see you just for this, but they love their dentist,
Yep.
they want to keep their dentist, could they do that?
Absolutely.
Yeah.
Yep. So I have several patients that I've seen that we won't force you to be in our office as a patient. We'd be happy to have you there, but we know comfort with who you've been seeing is a great thing. So I encourage patients to come in. If they have a provider already, I'll do an assessment, make sure that from their provider we receive that they have healthy treatment as far as teeth are stable, gums are stable, and we'll be able to communicate with their provider so that if the patient does get any treatment over time that we'll need to modify the appliance for, we can do that. So we certainly want to be able to have it open to any patients that are interested.
Would you be able to diagnose the sleep apnea, or would they have to come in with the sleep apnea diagnosis already?
So I do not diagnose for that. That's medical provider would need to do the diagnosis. But if someone is symptomatic, having daytime sleepiness, snoring, know that they're waking up gasping during the night, they can come in to see me first. I can talk with them about the risk factors and lead them in the right direction as far as referring them to the proper physician so they can have that diagnosis.
Okay, awesome. Is there anything else that you think everyone is important for them to know about TMJ or sleep apnea? Anything we did not cover?
So I would say that it's important to listen to your own body is really something that is, patients will sometimes know something's wrong but not sure what it is. And so, seek that diagnosis. Come in and speak with your provider, someone that's able to comprehensively treat you, will be able to really talk with you about all the possibilities, narrow that down, and get yourself to a comfort level.
Yeah, I think when it comes to teeth and spine, some people are just like we said, they have fear, they're afraid to go see someone because they're afraid it's going to hurt. There's a stigma with dentistry. There's a stigma with any kind of spinal work by a chiropractor, the cracking, the popping, right? So oftentimes they do nothing, and that's not always a good. That's when your body's telling you something. So like you said, listen to your body. I love that. And there are things that you can do, for TMJ. You don't have to suffer with that. There are things that you can do about your sleeping spouse that's snoring all night long and gasping for air, right? You don't have to live like that. There are solutions right here.
Yes.
So we are so glad you joined us today. We also have this month, we are giving out a few. I think we have 15 of them. We may have several of them left. $100 off new patient cleaning, exam, and x-rays to meet with Zoe Dental, to meet with Dr. V or any of the dentists there, and also combined with that, a chiropractic exam and x-rays included, and some office swag from Zoe Dental, some chapstick. So if you want one of these, we have a few of these at the office till the end of the month, so come and see us for that, or till the end of September, I believe. So anything else you want to share about dentistry, oral hygiene, the marriage of spinal hygiene and dental hygiene? So
I would just say that, I think prevention and maintenance is just so important for yourself. And I've always been fortunate to be, very on it with flossing daily, brushing twice daily. I use a mouth rinse as well. Starting as a patient and as a chiropractor patient, it's tough to implement the habits as far as the daily flossing for my spine. So find what motivates you to make those habits something that can last you, so that you can start implementing that. I know everyone is human and isn't going to be flossing every day,
right?
But there's always that room for improvement, and find what your place is in that, so that you can do what's best for yourself.
I love that. One thing we like to do with this podcast is kind of leave you with one thing that you can take action on now. And we took from the Dental Association the whole spinal hygiene move, or the dental hygiene movement that you all so successfully have done, teaching people that if they want to avoid coming to see us or to help us out and not have as many problems when you come see us, simply brush your teeth and floss, right? Dental hygiene, and come see us for your regular cleanings every 6 months or so. So we have created the spinal hygiene kit in our office, which we, like you were talking about. Yes, and the patients that actually do it, we teach, getting on a wobble disc and doing the dental roll for the cervical curve, and the TheraBands, and basically just movement, flossing the spine just like you floss your teeth to break the plaque off and keep everything moving in there. Same thing with the spine. We find that the patients that do their part, they say that, I love it. I feel good when I actually do it. So, and I'm sure you feel good when you actually floss and brush your teeth too.
You really do. You won't have bleeding gums. You won't have that sensitivity. So it will prove in itself when you can really get that maintenance down. And I love that you've combined it with dental, and it's such a good comparison with that, with reducing inflammation to maintain care.
Well, I appreciate your profession for giving us that idea. But yeah, people get it, they get it with their teeth. And, my thought is you can get your teeth replaced, you can get false teeth, you can't get a false spine. So, we really need to take better care of our spine. And some people need to take better care of their teeth as well, but we have to do it all. So that's why we're sharing this information, because we want you to do it all. So how can people find you? Where website? Where are you located? If they want to make an appointment with you now, where can they find you?
Absolutely. So we have our website for Zoe Dental. We also, if you drive right down the street, it's right behind the Huddle House, and a lot of patients will find us just from driving around, especially on Fridays. We are open Fridays. We're open Monday through Friday, so you can either just walk into the office and talk to our wonderful front desk staff, and they'll talk you through making an appointment, or give us a call. You can also reach out online. You're able to directly message there to be able to get an appointment.
And it's zoedental.com.
Yes.
Perfect. Okay, well, and we will put links to everything in the podcast episode and on our website when we send this out as an email as well, so patients can find you that way as well. So thank you so much for coming in and talking to me today, and I really learned a lot, and I appreciate you and your time.
Yes, it was my pleasure. Thank you so much.